I'm sorry, for some reason they tend to feel as if they can do this over the phone. They can try to push out the time of the personal one-on-ones and that type of thing. But it seems to be a huge gap in what they're providing. And that's the scary part, is the fact that, you know, they've been, like my sister mentioned, they had been fined once because of their, and they were supposed to kind of get it together and increase their, you know, their physicians and their nurses and that type of thing. But from all the people and all the input and all the emails that we've received, I mean, nobody seems to be getting the care that they need. You know, the only excuse they make is that, well, with this Obamacare and such, that, you know, there are more people coming on board and they're not equipped to handle it and that type of thing. But, you know, does that work? I mean, is that a viable excuse for not handling them? We're talking about people's lives here. You know, it seems a pretty dangerous way to handle your business. I mean,
okay, I think a request I would make of the Department of Managed Care is to review this particular case to see if there's any
We've given that.
abnormalities that don't conform to the parity laws that we have.
yeah, we have been in contact with them, and we have filed, I don't know.
Like it doesn't follow the laws in terms of equal access for the mental health condition. It's odd that 3 or 4 switches of medications of such strength as these
And not being
medications
seen.
that you would normally require somebody to come in for more thorough evaluations by medical doctors before you would do that. That's the only question I would have.
That's mandated that they do, and
Yeah,
she was pushed
so-
out 2 months.
That's what the parity law is supposed to ensure, so I would ask that that be looked at by the department so we can find out, maybe get a, if it's okay with the family,
Well,
get some
We have her
information
medical
about
records
that.
here if you want to take, if we leave them, or even a copy of what was said.
No, we're having a hearing here to look at how we should, because we're just starting this parity enforcement, how we should enforce the law. And we want to make sure that insurers don't operate on I call it a fail-first medical system, you know, where people have to fail before they get services. And that's my suspicion here, but I'd like to have the department maybe examine it so we can find out, you know. And I think it's the same thing with your son, if I may, Ms. Menzold, sort of you know, until he got to a very high level, it seems like there wasn't any services that were adequate, and therefore it's sort of like he had to fail dramatically before they would give him services. I call that the fail first policy, which I think it violates, in my opinion.
Yeah, the system is definitely clinician-centric and deficit-based. So you have to fail, you have to be severely ill in order to receive certain services. And if you're an adolescent or a child, there's a whole range of services that aren't available to you that should be available to you.
Right. I think that's, fail first is a violation of the parity laws, I believe. So I'd like to know whether or not what I'm saying is maybe we can use these 2 cases, if it's okay with the families, to look at that in terms of case, maybe a kind of a case study that would help other families so your horrible situations won't be in vain if you want to, with your mother, and we can learn by this horrible experience that happened, you know, and maybe make some improvements for other families in the future.
My couple of questions were, I thought that medications of this type you needed to be seen and have an office visit for that medication to be prescribed.
That's why I'm asking.
I'm thinking, and then they have to know, I mean, what we looked at and just knowing some of the things we know, I know with antidepressants, For many people, it doesn't have too much or any benefit to. For some people, after quite a few weeks, it has some powerful and good benefits and gives them some help. But what we seem to have found out is that if there is going to be a problem with it, it's within when you go on to a new medication or you do an increase in dose, that first days or weeks can show where you're having a problem to it. And it was like with my mother, that's what it seemed it was. She was okay on the one dose, wasn't getting a lot of benefit from it, but she was okay. We took her for Mother's Day, she was fine. Now you increase the dose and she's losing 10 pounds, she's not sleeping, what happened between then and that? There was no life event that happened. The only thing was a change of medication. Her speaking and saying that to a doctor, I'm not a doctor, but I would think, oh, she just went up in an increase on an antidepressant. That does have, we know, can have for some problems. And for her not to be seen, it doesn't make sense to us. It just doesn't make sense.
Senator Mitchell.
Thank you very much, Mr. Chair. First of all, let me just say how much and we deeply appreciate your willingness to come and share very painful, very personal stories. And I applaud your courage in doing so. And I hope you understand how important it is for us as policymakers to have a context in which we set policy. It's one thing to introduce legislation, as the both chairs have, to talk about parity. It's another thing as policymakers for us to do our job around accountability and oversight of state departments who are charged with implementing the policy we set. So for those reasons, you coming to tell your story is very important. What strikes me in hearing both accounts is we really only have on the agenda today one health plan, Kaiser. But what strikes me is what I read in the briefing document provided by committee staff. Thank you for this document. And if I may reference a paragraph or two, Mr. Chair. And it talks about the managed care report card system that we worked very hard 25 some odd years ago to create so consumers could have a kind of an apples to apples assessment of the quality of care provided by health plans. The 2015-16 HMO and PPO quality report cards for behavioral and mental health indicate that of the 16 California HMOs and PPOs rated, almost half received a 3-star rating of good for helping consumers get the behavioral and mental health care they need. Kaiser Permanente Northern California is the only plan that received an excellent rating of 4 stars. 6 HMOs and PPOs received 2 stars, and HealthNet's HMO and PPO each received a poor rating of 1 star. Kaiser Permanente Northern California is the only HMO or PPO that exceeded national counterparts on quality measures related to the diagnosis and services of depression in the acute phase, which is in the first 12 weeks. So what is striking to me about that information is, as we hear, albeit one account, your life experience with your mother, they're rated excellent. What is overwhelming to me as I sit here and listen to you is recognizing how many stories are similar to yours that are multiplied all over the state. I wonder if we're tracking the number of people who are seeking services who are opting out of their plans. So as we're working hard as a legislature to expand access to care, people are not finding appropriate or adequate care in their plans and are opting out. I wonder if we or the Department of Managed Health Care even have a real sense of the magnitude of the problem that we're dealing with as we talk about parity and access to critical services. You talked about the medications, and Senator Bell wanted to dig deeper. This body passed a series of bills this past year that the governor signed dealing with psychotropics, and they're being overprescribed to the foster care population. And here we have a private former employee of the plan who also couldn't get appropriate tracking of very powerful medications that do have very different reactions to different people. These are questions we'll raise later in the panel, but I just thought it was really important that as we were talking about a particular plan, that we have a broader understanding of the weight of the problem, that is the plan that was rated the best in the report card system. And what, could your mother have possibly done different to reach out and follow the protocol in terms of reaching out and asking for help? And perhaps these national standards by which Kaiser was measured are not appropriate. If medications can be changed and increased via a phone contact with a 60-day delay in actually seeing someone, perhaps those national standards, Mr. Chair, need to be evaluated too. Because in listening to this story, albeit one story of, thousands of patients, I'm sure for Kaiser North, how that could contribute to an excellent rating is beyond me. But again, thank you to all of you for your willingness to come and share. Deeply appreciate it.
With the tracking portion of it, I believe it was found that Kaiser had been found guilty of
Yes.
shuffling
Yes.
their patients. And I believe somewhere in the medical records for my mother, that was spoken to her about her possibility of leaving their care to go elsewhere, to where they can now be in a, maybe when these problems become serious, they will shuffle you into a government-funded program to where that it no longer puts a shadow upon them and then goes on to the government-funded issues. And so that in itself is, I believe, has been found. Kaiser was guilty of it.
So there was documentation or references in your mother's file where it was suggested by Kaiser that she seek treatment elsewhere?
Correct, yes. It was at one point, and that's when she had first said that she was having a suicidal thought. Again, my mother was not, you look at her walking the street, this is a vibrant woman. This is not a woman that is hunched over and she was alive. And when I first heard that she had passed, I had no idea that's what took place. That was not, my mom, she finally did it. No, that never crossed my mind. I had to call back 20 minutes later to say, well, let me absorb what happened. What happened? And then to find out that she went to Kaiser with her Kaiser card in hand and jumped. Why is she holding her Kaiser card? She has her license and she has her Kaiser card. She's trying to make a statement of you are the cause. So
I think hearing the stories from both of you, it's clear that there is a spectrum of need. And I think, I'm sure the challenge the service providers are encountering is how do you provide a spectrum of services? And as you suggested, to suggest that you are an expert in all things mental illness related for all populations is not helpful,
Yeah,
to put it mildly.
yes, absolutely. And I think that's true. I have some experience with Kaiser, but it's a while back. And so I don't really want to bring that to the table because I think things are changing at Kaiser. I think that, the fact that they got an excellent rating may in part reflect the nature of the people who are coming to them for service. The people with severe mental illness, like her mother experiencing, are a much smaller number of people than the number of people who are coming to them for service because they're getting a divorce, or they, their parents are getting a divorce, or, something difficult is happening in their life, but their problem is a transient one that's amenable to therapy. Right, it's amenable to therapy. It may or may not benefit from medication, but it's not severe mental illness where, you're talking life-threatening consequences consequences for choices of medication treatment. There was a lack of opportunity, it sounds like, for her to receive therapy, a lack of opportunity for her to receive intensive outpatient care, which is should be part of all the range of services available. There are things about that case that go beyond just the question of should her medication have been changed 3 times in 3 months.
Right.
And that reflects.
The issue you raised about geography in terms of were those options available to her with.
Right, and I don't know if they were in Santa Rosa, but even when they are available, there aren't enough of them. I know I've heard that Kaiser had like 29 openings for psychiatrists in the last year. They can't fill the slots, so how can they provide the services? Which is the reason why one of my suggestions was to look at incentivizing people to become psychiatrists or to become psychiatric nurse practitioners. Because I think that gap in care, we don't know to what extent that gap in care is an artifact of lack of people and lack of beds.
And then the plan's challenge is we as policymakers say, if you're going to take this population, you have to provide this scope of service, and if they are not equipped to do so, how do you say that, quite frankly? We can provide this is what we're good at. Kaiser's good at, well baby checkups and immunizations, but maybe not this scope of service, but how do we continue to be a player and a partner with the state in providing the scope if we don't have that manpower, expertise, or capacity? So it's a real catch-22.
Well,
Thank you very much.
I just want to point, but you're pretty much right on to where your thought process is going. There should be a certain standard that is kind of set by the state, if that's or federal or state, where you need to at least meet that scope of quality care. And if you can't provide it, then drop it, get rid of it. And you need to maybe say, okay, you're not doing this well, so don't. But being this all-encompassed 7-Eleven is just, it's okay if you go into the grocery mart and they don't have an item you want, but if you're.
Go to the next one.
Exactly, but if you're in dire need and you think you're going to get the help and it's not there, you keep trying to ask and ask for it and it's not there. The other point I want to make is that they pretty much, Kaiser, as my sister had mentioned, tremendous care, that type of thing, statements. But it was interesting, my father's birthday was November 16th, and on that day, there was an article on that day and the following day in the Chronicle, the San Francisco Chronicle, that talked about the union, and they were trying to negotiate a settlement. And even the doctors and the nurses were stating the fact that there was not enough. They didn't have enough help, that they were overworked because they didn't have enough people to take the demands of the patients and blah, 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 that type of thing. So there was the ratio that they were overworked because there was too many patients that had come in for the good Kaiser medical care that they do provide. We're not totally against them, but on this aspect of it, they said on their department, and several days later, they settled the contract. But there was a lot. They were using this as a negotiation tool against Kaiser to, I hope it was to help us. I hope it wasn't just to help them get a pay raise, which they did get. So, they even admitted that they've got problems within it. But, they should at least come to you, or there should be some, like you say, somebody above them that says, time out, we need to reevaluate this, and you need to send out a letter saying we're not able to provide this service. If you do have problems, there's got to be contingency plans somewhere along the lines to help people out. Now, I understand if they're not able to take care of it. You bring your car in, maybe, your transmission's out. Well, we don't do that. We're going to send you here. But, these are people's lives we're talking about. It's not something we can just say, well, we messed up on that one.
And
I would agree with you.
Thrive campaign bases it off of all, it's a come one, come all.
I think Senator Bell has another question, then we'll hold off on the comment
Yeah,
until
thank you
the
very much.
question is asked of you.
Senator Mitchell's questions and the comments of the families should be part of the evaluation done by the department. As people know, I sort of had the record of the most gubernatorial vetoes of any bill under the Schwarzenegger administration, which was 4 times of my mental health parity bill. Vetoed my bill 4 times. We presented the legislature to create a state law that defined parity. It was vetoed that many times. But now that we have money in the budget to do parity enforcement, I question whether or not we have enough resources to do the extent of parity enforcement that we need to do. And I think these cases pretty much indicate that we don't have enough resources to fully implement parity. And that's a question I'll be asking over the next month. And thank you for your help in us making this issue come forward. And I know that I hope that anything we can do in our, because I'm part of it too, our NAMI community to help your family in terms of what's happening now, in a support for you can be done. I hope you stay involved in the group, the NAMI group. I work with a lot of families that had situations with suicide like yours, and it's a very strong community that will support you.
Okay, I'd like to take this opportunity to thank the Reagan family for their story. I'd also like to thank Patricia Wenzel for her testimony as well. We will now move on to item number 3, health insurance regulators. Thank you very much.